There's really only three areas, main areas, that shoulder pain can emanate from. You either have a rotator cuff problem, an instability problem, or an arthritis problem. So what goes wrong in the shoulder is in one of the anatomic areas. This is the humeral head, or the ball part of the ball and socket joint. This is the socket part right here. This is your rotator cuff right here. So this is the area that's becoming inflamed in rotator cuff disease. In instability, what happens is the ligaments, which are here, that attach to the cartilages, they get torn and the shoulder tends to slip out the front. And lastly, with arthritis, it's a problem with the joint. This is the articular cartilage, this white substance here, and in arthritis that substance degenerates. It's like the tire tread wearing off a tire. We can't put the tread back on after it wears away, and that's arthritis. So if you're under the age of 40, you probably have an instability problem. If you're over 40, you probably have a rotator cuff problem. If you're over 65, well, you're on Medicare, and you're getting to be my age, and you have either cuff pathology or osteoarthritis. And if you're over the age of 75, you're likely to have what's called a rotator cuff arthropathy, and that's a bad combination of rotator cuff disease and osteoarthritis, where not only do we have a loss of the articular cartilage in the joint, but we have a loss of the rotator cuff, and that can cause pain.